Meaningful Use Stage 2, Core Set 5, Record Smoking Status. The requirement of Core Set 5 is to measure that all unique patients 13 years and older who are seen by the eligible provider have their smoking status recorded in the structured data. The objective is for all patients over the age of 13 to be queried as to what level of smoking. Now, at the end of the reporting period, the results reported for attestation is going to amount to a number of unique patients over the age of 13. This, of course, is going to be reported by means of a denominator and a numerator. The denominator is all unique patients over the age of 13 who are seen by the doctor within the reporting period and prior to attestation. The numerator will be the number of those patients who are queried for their smoking status, and the smoking status is actually linked to a SNOMED code. You are not able to simply answer yes or no, as in previous versions with the early adopters of Meaningful Use 2011. Some were able to just say yes or no. Certification now requires that the actual value be specific as to whether they are current, former, heavy, light, and so on. And that is what the SNOMED code will tell. There is no provision for excluding unless you treat nobody over the age of 13. So for certain pediatricians, if you stop treating patients when they reach adolescence, you're able to exempt yourself. Now, in prognosis, this is achieved through the social history template on the patient's face sheet. So I've opened my test patient, Joe Bismatics, and we simply go into the social history, and our question, smoking status, MU, has different values available. And each one of these values is linked to a SNOMED code. Now, you do not visually see the SNOMED code behind the scenes, but that is what will be picked up on the Meaningful Use report. This does require, of course, that you are using this specific question. You'll notice here in the case of On the Bay Internal Medicine, we have our old smoking history question as well, which accepted yes/no answers. Those do not have SNOMED codes behind them. Therefore, you might want to inactivate that and remove it from your template altogether so as not to be confused, or at least make sure your staff knows to answer the new question, which is specifically labeled smoking status MU and has these 8 standard values predefined.